The first one is the biceps brachii, origin of the long head from the supraglenoid tubercle, short head from the coracoid process, insertion into the radial tuberosity, nerve supply by the musculocutaneous nerve. Action, it helps in elbow flexion and supination of the forearm. The second one is triceps, origin of the long head from the infraglenoid tubercle, medial head from the posterior part of the humerus, lateral head from the posterior part of the humerus. Insertion into the olecranon process, nerve supply is by the radial nerve. Action helps in elbow extension. The third one is coracobrachialis, origin from the coracoid process, insertion into the medial surface of the humerus, nerve supply by the musculocutaneous nerve. Action, it helps in arm flexion and adduction of the shoulder. The fourth one is the brachialis, origin from the lower part of the humerus, insertion into the coronoid process of the ulna, nerve supply by the musculocutaneous nerve. Action, it helps in elbow flexion in a pronated position and also in all other positions. Therefore, the brachialis muscle is considered to be an important and pure flexor of the elbow. Fifth one is the brachioradialis muscle, origin from the distalmost lateral part of the humerus, insertion into the styloid process of the radius, nerve supply by the radial nerve. Action, it helps in elbow flexion in a mid-prone position. Therefore, here you need to remember that the biceps brachii helps in elbow flexion in a supinated position. The brachialis muscle helps in elbow flexion in a prone position, and the brachioradialis muscle helps in elbow flexion in a mid-prone position. The sixth one is the rotator cuff. The rotator cuff is formed by the following muscles. So remember, sits. S for supraspinatus, I for infraspinatus, T for teres minor, S for subscapularis. Let's see the first one, which is the supraspinatus muscle, origin from the supraspinatus fossa, insertion greater tubercle of the humerus, nerve supply suprascapular nerve, since it is supraspinatus, suprascapular nerve, and action helps in initial 0 to 15 degrees of shoulder abduction. Then we have the infraspinatus muscle, which originates from the infraspinatus fossa, insertion into the greater tubercle of the humerus, nerve supply by the suprascapular nerve. Action helps in external rotation of the shoulder. Then we have T for teres minor, origin from the lateral border of the scapula, insertion into the greater tubercle, nerve supply by the axillary nerve. Action helps in external rotation of the shoulder. And then once again, S for subscapularis muscle, origin from the subscapular fossa, insertion into the lesser tubercle of the humerus, nerve supply, subscapularis muscle supplied by the subscapular nerve. Action helps in internal rotation of the shoulder. The seventh one is the deltoid muscle. It has three parts, that is the anterior, middle and the posterior. Origin of the anterior part from the lateral 1/3 of the clavicle, the middle part from the acromion process, and the posterior part from the spine of the scapula. Insertion into the deltoid tuberosity, nerve supply by the axillary nerve. Action, anterior part of the deltoid muscle helps in shoulder flexion. The middle part of the deltoid helps in 15 to 90 degrees of shoulder abduction, and the posterior part helps in shoulder extension. The eighth one is the vastus medialis, origin from the lower part of the intertrochanteric line, insertion into the base of the patella, nerve supply by the femoral nerve. Action helps in extension of the knee. The eighth one is the vastus intermedius muscle. Origin from the anterior lateral surface of the shaft of the femur. Insertion into the base of the patella. Nerve supply by the femoral nerve. Action helps in knee extension. The ninth one is the vastus lateralis muscle. Origin from the upper part of the intertrochanteric line and the greater trochanter. Insertion into the base of patella. Nerve supply by the femoral nerve. Action helps in knee extension. Remember that the vastus medialis, vastus intermedius and the vastus lateralis muscle, all these three muscles combine to form the quadriceps muscle, which help in playing a primary role in knee extension. The 10th one is the rectus femoris muscle. It originates from the anterior inferior iliac spine and from the acetabulum. Insertion is into the base of the patella. Nerve supply by the femoral nerve. Action, it is a two joint muscle. Therefore at the hip joint it helps in hip flexion and at the knee joint it helps in knee extension. The 11th one is the sartorius muscle. Origin from the anterior superior iliac spine, that is the ASIS. Insertion into the tibia. Nerve supply by the femoral nerve. Action, it is a two joint muscle. Therefore at the hip it helps in abduction and external rotation, and at the knee joint it helps in knee flexion. The sartorius is also called as the Taylor's muscle or the honeymoon muscle. The 12th one are the hamstrings. So the hamstrings are formed by the semitendinosus and the semimembranosus. Both these muscles originate from the ischial tuberosity and they insert into the tibia. Nerve supply by the sciatic nerve. Action helps in flexion of the knee and it is a weak hip extensor. The 13th one is the iliotibial band, also called as the IT band. Origin is between the tensa fascia lata, the gluteus medius and the gluteus maximus muscle. Insertion is into the Guddy's tubercle on the tibia. Action prevents varus stress at the knee joint. In knee flexion, the IT band moves posterior to the knee. In knee extension, the IT band moves anterior to the knee. The 14th one is the ACL or the anterior cruciate ligament. Origin from the anterior part of the medial tibial plateau. Insertion into the medial part of the lateral femoral condyle. Action prevents anterior displacement of the tibia and it gets taut during knee extension. Blood supply by the genicular artery. 15th one is the PCL or the posterior cruciate ligament. Origin from the posterior part of the lateral tibial plateau. Insertion into the medial femoral condyle. Action prevents posterior displacement of the tibia and it gets taut during knee flexion. Then let's see the adductor muscles. The adductors are formed by the adductor magnus, adductor longus and adductor brevis. The first one is adductor magnus. Origin from the pubis and the ischial tuberosity. Insertion into the linea aspera. Nerve supply by the obturator nerve and the sciatic nerve. Therefore this is considered to be a hybrid muscle. Action helps in adduction of the thigh. Then we have the adductor longus. Origin from the pubis. Insertion into the shaft of femur. Nerve supply obturator nerve. Action once again helps in adduction of the thigh. The next one is adductor brevis. Origin from the pubis. Insertion above the adductor longus. Nerve supply obturator nerve. Action helps in adduction of the thigh. The 17th one is the gracilis muscle. Origin from the pubis. Insertion into the tibia. Nerve supply by the obturator nerve. Action helps in flexion and medial rotation of the thigh. It is a weak adductor of the hip and it is also used for transplant. The 18th one is the piriformis muscle, origin from the sacrum, insertion into the greater trochanter. Nerve supply is the ventral rami of S1 and S2. Action: with the hip in extension, it helps in external rotation of the hip, and with the hip in flexed position, it helps in abduction of the hip. 19th one is the gluteus maximus, origin from the iliac crest, the sacrum and the coccyx, insertion into the gluteal tuberosity, nerve supply by the gluteal nerve, action helps in extension of the hip. 20th is the gluteus medius, origin from the ilium, insertion greater trochanter of the femur, nerve supply gluteal nerve, action helps in abduction of the thigh. 21st is the gluteus minimus, origin from the ilium, insertion into the greater trochanter of the femur, nerve supply by the gluteal nerve, action helps in abduction of the thigh. 22nd is the gastrocnemius, origin from the medial and the lateral femoral condyle, insertion into the Achilles tendon, nerve supply by the tibial nerve, action helps in plantar flexion of the foot. 23rd is the soleus muscle, origin from the upper 1/4 of the fibula and the middle 1/3 of the tibia, insertion into the Achilles tendon, nerve supply by the tibial nerve, action plantar flexion of the foot. 24th are the peroneus longus and the peroneus brevis muscle, origin from the fibula, insertion into the fifth metatarsal bone, nerve supply by the peroneal nerve, action helps in eversion of the foot. 25th is the tibialis anterior muscle, origin from the tibia, insertion into the first metatarsal, nerve supply by the deep peroneal nerve, action helps in foot inversion. 26th is the multifidus muscle, origin from the sacrum, transverse processes of the cervical, thoracic and the lumbar vertebrae, insertion spinous process of the second to the fourth vertebrae above the origin, action bilaterally it helps in back extension, unilaterally it helps in side flexion of the back, unilaterally it also helps in rotation of the spine, nerve supply is by the spinal nerve. 27th is the trapezius muscle, origin from the occipital protuberance, the ligamentum nuchae, the spinous process of the cervical and the thoracic vertebrae, insertion in the lateral 1/3 of the clavicle, nerve supply by the accessory nerve, action helps in shrugging of the shoulder. 28th is the serratus anterior muscle, origin from the first upper 8 ribs, insertion into the vertebral border of the scapula, nerve supply by the long thoracic nerve, action it helps in abduction and upward rotation of the scapula. It is also called as the boxer's muscle. 29th is the latissimus dorsi, origin from the spinous process of T7 to T12, the thoracolumbar fascia, the iliac crest and the inferior angle of the scapula, insertion into the intertubular groove of the humerus, nerve supply by the thoracodorsal nerve, action it helps in shoulder adduction, shoulder internal rotation and shoulder extension. 30th is the pronator teres muscle, origin from the medial epicondyle of the humerus and the coronoid process of the ulna, insertion into the upper 1/3 of the lateral surface of the radius, nerve supply by the median nerve, action helps in flexion and pronation of the forearm. 31st is the pronator quadratus muscle, origin from the distal part of the ulna, Insertion into the distal part of the radius. Nerve supply by the anterior interosseous nerve. Action helps in pronation of the forearm at the distal radio-ulnar joint. 32nd is the flexor digitorum superficialis. Origin from the medial epicondyle, the coronoid process and the anterior aspect of the radius. Insertion into the second to the fifth mid-phalanges. Nerve supply by the median nerve. Action helps in wrist flexion, MCP flexion, that is metacarpophalangeal flexion, and PIP, that is proximal interphalangeal joint flexion. 33rd is the flexor digitorum profundus. Origin from the proximal half of the ulna and the interosseous membrane. Insertion into the second to the fifth distal phalanx. Nerve supply by the median nerve. Action helps in metacarpophalangeal flexion and DIP flexion, that is distal interphalangeal flexion. 34th is the rectus abdominis muscle. Origin from the pubic symphysis. Insertion into the xiphoid process and the 5th to the 7th ribs costal cartilage. Nerve supply by the intercostal and the subcostal nerves. Action helps in trunk flexion. 35th one is the pectoralis major. Origin from the medial part of the clavicle, the sternum and the upper 6 costal cartilage. Insertion into the lateral lip of the bicipital groove of the humerus. Nerve supply by the pectoral nerves. Action helps in flexion, adduction and medial rotation of the arm. 36th one is the pectoralis minor muscle. Origin from the 3rd, 4th and the 5th ribs. Insertion into the coracoid process of the scapula. Nerve supply by the pectoral nerves. Action helps in depression and protraction of the scapula. 37th one is the transversus abdominis muscle. Origin from the 7th to the 12th ribs, the thoracolumbar fascia, the iliac crest and the inguinal ligament. Insertion into the linea alba. Nerve supply by the thoracoabdominal and the subcostal nerves. Action helps in flexion and rotation of the trunk. 38th is the external intercostal muscle. Origin from the lower border of the rib. Insertion into the upper border of the below rib. Nerve supply by the intercostal nerves. Action elevates the ribs during inspiration. 39th one is the internal intercostal muscle. Origin from the costal groove of the above rib. Insertion into the upper border of the below rib. Nerve supply by the intercostal nerves. Action depresses the ribs during expiration. 40th is the sternocleidomastoid muscle. Origin, it has two parts, that is the sternal head and the clavicular head. The sternal head originates from the manubrium. The clavicular head originates from the medial part of the clavicle. Insertion, sternocleidomastoid, so it inserts into the mastoid process. Nerve supply by the spinal accessory nerve. Action, unilaterally this muscle helps in side flexion and also rotation of the head to the opposite side. Bilaterally it helps in neck flexion. The 41st muscle is the biceps femoris. Origin of the long head from the ischial tuberosity, the short head from the linea aspera of the femur. It inserts into the fibula. Nerve supply by the sciatic nerve. Action, it is a flexor of the knee and it is a weak hip extensor.